everyone, we're here with Dr. Mookadam from Mayo Clinic. Hello, Dr. Mookadam.
Hi.
Hi, thank you for volunteering at the healthcare event. There's a line around the block of patients looking for healthcare screening. What made you kind of volunteer and take your time off on a Saturday morning when you could have been home enjoying golf, enjoying TV, but giving your time away so freely to the community?
My students tricked me into this, or they asked me probably about a year ago. So I think this is, the fourth or fifth time I've been, and I just really enjoy it. Watching the students interact with the patients in a different environment than they used to at Mayo, they really like it, and they need these kind of interactions, I think, to solidify their critical thinking and their personal skills, their communication skills.
Like a real world skills interacting with inner city, underserved communities, where people are just getting poor care. There's a lot of barrier to access to care issues. Talk to us a little bit about access to care issues and what our representatives can do to help us in a more of a policy level. Sorry, I know that was a little more.
That's a lot. I don't know.
Well, the reason I'm asking is we can do what we can do, volunteering our time, getting our local community to get together to help. But there's got to be a policy level decision that can really help these people. It can't just be throwing more money, but we need more funding, we need more organizations, we need more structural way to be able to help the inner city, underserved communities. For example, you talked about a patient with, a difficult medication, a medication that wasn't suitable for her. Instead of putting them on the 24-hour blood pressure medication, and that's why their blood pressure wasn't managed appropriately.
Right.
I know the federal government has the quality measures and all the measures that doctors have to follow, but this is more than that kind of issue, isn't it?
Yeah. I think the thing that I've noticed the most, is people don't have a PCP. If you don't have a primary care provider, everything falls through, right? So patients don't know how to take their medications. They're taking them at the wrong time. They don't get follow-up on screening. They don't get follow-up on blood pressures, things like that. So I think that's the biggest thing, is connecting people to somebody who can look after them in a longitudinal way. Talk to them about, about their health maintenance things. Make sure they're getting all of their screening, their cancer screening, everything on top of that, and that they're getting the social resources that they need as well. I talked to a patient today who had been doing really well in California and now is doing terribly here. And the only thing the main thing that changed was that her medications in California, her pharmacy had put them into like a blister pack, so it kept them organized. And now all of her medication were just in her bag. She really was quite confused about it, and so she just needed that to be put together. So sometimes they need somebody who will listen to their story and sort those kind of things out. And that's, I think that's mostly what I've seen that patients need, is just guidance.
So you're talking about the reimbursement issues. The pressure for the family, the primary care is to be seeing patients every 15 minutes because the low reimbursement has gotten so low. So this is more of an issue of bigger, broader issue that has a lot of many facets and components to it that we need to address. That we can't do in this quick 5-minute interview. But I'd love to talk to you more about that, absolutely.
Although, what we've done here with the students and so on, at least the people that have come here, we've been giving them that guidance. So it's worthwhile, yes, they got their eyes screened, but we also were able to give them that little piece of guidance. Whether they can have it moving forward, I guess that's up to somebody else, but we're really trying to do that today.
Well, thank you so much for your time here, and we really appreciate you.